from the station that's on your side. This is Channel 7 News Daybreak.
Welcome back. The time now is 6:24. October is Breast Cancer Awareness Month. As you know, a great opportunity to remind us all of the importance of early detection, and to help us understand our role is a new doctor, not only to Daybreak, but a new physician for Baptist Health as well. We have family practice physician Dr. Laura Lester here with us this morning. She drove in from Malvern. Welcome to the show. We're so glad you're a part of it. Before we talk about breast cancer awareness, tell us a little bit about yourself.
I'm originally from Texarkana, Texas, and then I went to undergrad at U of A in Fayetteville, and I've kind of called that home since. And after med school, I got to return to Fayetteville for residency in family medicine, and then I met my husband there, and now we're here.
Yeah, and he's part of the clinic too.
He is, Ricky Chastain. We have the names are separate to keep the confusion down, but
right.
Yeah, we're at the Baptist Clinic in Malvern, family practice, and we love it.
Okay, tell us why you were interested in being a family physician.
Family medicine is you get to see everything. You get to see, we see anything from babies to elderly, chronic care, preventative medicine. It's kind of a little bit of everything. You get to know people's families. You get to know their history. And you just kind of get to know them.
Constantly building relationships.
Yes, and it's so much easier to practice medicine when you know your patients like that.
Okay, moving on to October being Breast Cancer Awareness Month. What is the most important thing you want women watching right now to know?
The biggest thing is self-awareness. You know your body better than anyone else. I tell all my patients that you're going to be the first one to know if something's wrong. Usually, you're going to be able to tell if something is slightly different than it was before just because you're used to feeling it. So being self-aware and knowing the signs and symptoms to look for, any kind of discoloration, any changes in the size or shape of your breast, obviously lumps or knots, discharge, any irritation at all or abnormality that you see on your breast or with your nipple, that is something to talk to your doctor about. And no issue is worth ignoring. I think people sometimes come in and say, oh, I don't know if I should ask this or not.
This is probably nothing.
Yeah, and just ask, because you're better safe than sorry, and nobody is ever going to get mad at you for coming in and making sure that you're healthy.
There's the list of those warning signs and symptoms for you to be aware of. Let's talk about mammograms. It seems like there's been some controversy over when women should get them, guidelines changing. What do you tell your patients?
Guidelines, everybody has a different opinion. You can look up 6 different places and have 6 different opinions. They changed recently. Some of the resources changed and said that's okay to have every other year for a mammogram. We still believe that every year is really the key. Starting at age 40 even, every year having a screening mammogram just to make sure that everything's fine. That's really the gold standard, because this is something that your chances are better when you have early detection and when you catch things in the beginning stages, and that's what we're trying to do.
And it's something your doctor might remind you of, but you have to take control of your own health and schedule those mammograms.
Yes, you do. Your doctor can help you and should encourage you, but that is something that you can say no. Please don't. But I know it's probably uncomfortable for a minute, but it's worth it in the long run.
Dr. Laura Lester, thanks so much for being here.
Thank you.
Great
Thanks for
information
having me.
as we are in the middle of Breast Cancer Awareness Month.